Hey there, pharmacy owners. Dr. Lisa Faast here from DiversifyRx, and I'm going to be talking about something that maybe isn't so sexy, but is ultra critical to your pharmacy success, and that is monthly financials. Now, those of you who own a pharmacy and you get your monthly financials by the next month, early in the month, raise your hands. Those you don't, it's okay. It can be fixed. Now, a lot of times when I'm talking to a pharmacy owner, they don't really understand the value of monthly financials because they really don't understand how to read and use the financials. And so you don't know how to read and use them. So why pay to get them? I mean, that makes complete logic sense. But get monthly financials that are timely. You don't want them 6 months later. You want them every month, usually within about 10 days of the close of the previous month. It can actually tell you a lot about your pharmacy, help you make better decisions, kind of be tsunami warning signs. You know how we have all the tsunami signals out in the ocean to kind of early warn you about an impending tsunami? That's what financials can do. And how it makes them easier to read is to turn your financials into some KPIs, key performance indicators, really just some data points. And you don't have to understand how to all do that. Now, granted, I'm a financial number nerd. I love doing that, but not all of you are nerds like me like that. And so give it to your accountant, give it to your bookkeeper, let them figure that out. Now you have to tell them which KPIs are important. If you're not sure, we're here to help. We have tons of blogs and videos on KPIs. For pharmacies, there's three critical ones, absolutely critical, which is your payroll ratio, your inventory turns, and your expense ratio. But there's a bigger set of KPIs that are good for managing your entire business. I would usually look at maybe 7 to 10 on a month. Trust me, that might sound like a little lot. Trust me, it's not as scary as it sounds. Once you know the KPI and once you know the benchmark, your CPA or your bookkeeper can make it fairly easy to help understand your financials. And understanding your financials is literally like reading a patient's blood pressure and blood sugar level and A1C. You can look at a patient's few vitals and immediately kind of like know how healthy is this patient? Are they getting healthier or are they getting sicker? That's what financials are for your pharmacy. By looking at just a key few data points and understanding those, you will know if your pharmacy is headed in the right direction or if it's headed in the wrong direction. So if you don't get financials because it just was never a priority, I highly recommend you doing that. Bookkeepers are good. CPAs can be good. You want to make sure, obviously, you don't pay too much. You want to make sure it's good. I like some of the pharmacy specific ones. Pharmacy is just a weird world in terms of finance and payables. Although you don't have to use a pharmacy specific one, you can use a local one. When I first owned my pharmacy in California, I actually had a CPA next door to me, and that worked out really well when he was my CPA. And I just had to kind of teach him the pharmacy KPIs. So we're happy to do that with you. You can always send your accountant. We have plenty of people that will send the accountant our KPI blogs, and that way the accountant knows what data and numbers are most important for the pharmacy and where they should be hitting. So it's perfectly fine to use somebody that's not pharmacy specific. General, just the more I know and understand pharmacy financials, the more I see the importance of using somebody that is pharmacy specific. But it's most important that you just get them accurate, you get them every month, and you take a look at them. Sometimes it's painful. I've known some pharmacy owners that just don't want to understand and look at their financials because they're kind of putting their head in the sand. They're kind of just ignoring. It's kind of like when you're overweight and you don't step on the scale because you're like, I just don't want to know the number. I've been there, I get that. But this is your business you're talking about, not only your own livelihood, but the livelihood of all your employees, the health and wellness of your entire patients. And so you kind of have to do the hard thing, which is look at your financials and really understand them. Once you understand financials, like I remember those early moments of pharmacy ownership when I went from I had no clue what I was looking at to all of a sudden I could read financials like you read a blood lab report. And all of a sudden it was like, solutions and things just came off the paper and like into my brain. It's like I can now see what was happening in my business and make better decisions to go in a certain place. And that's really the power of financials is you understand where you're leaking money, you understand where you're just blowing money, you understand where you're making money, and you can just help fine tune and optimize your pharmacy, because that's how you be successful in pharmacy. When we have razor thin margins and profit like we do in traditional retail independent pharmacy, the only way to really thrive is you have to optimize all of those. You have to squeeze every penny out of every possible stone that you can. And your data, your financials, is what helps you do that. So if you don't get them, get them. If you have any questions about where to get them, happy to help you with that. We have several friends in the financial space, RX Visors, Prestige Bookkeeping, Titans. Those are just some that come to mind, and they're fantastic pharmacy specific bookkeepers and accountants. Some of them can do your taxes and everything. Some of them will, just do your financials. And it's just really important. And if you need help understanding your financials, that's what we're here for. That's what we do inside Pharmacy Badass University. We help you become a pharmacy CEO and really understand all of those things that you need to understand in order to lead your pharmacy forward and to have higher success and to meet all the goals that you want. A lot of us want some financial freedom. We want to have bigger impact for our patients. We want stability for not only ourselves, but our employees and our patients. And so we can only do that when we level up and we figure out how to lead our pharmacies forward. So pop this in the comments. If you think this was helpful, please share this with a pharmacy owner friend or colleague. And if you need help, reach out. I'm happy to answer any questions and see if maybe we can help you understand your financials better so you can make your pharmacy better. So until next time, talk later. Bye-bye.